is Maureen Elias, and I served in the U.S. Army from 2001 to 2006 as a counterintelligence agent. Normally when I tell people that I served as a counterintelligence agent, they always get this kind of wow look on their face, because I think everyone pictures James Bond, and I wish that's what it was like. It wasn't nearly that cool, but it was still an exciting job. I served right after 9/11 occurred, and so my job was not also counterintelligence, but we also did some counterterrorism work because of what had just occurred in America. And so there was never a moment of downtime. We were always hopping around doing exciting stuff, and I really enjoyed my time in the service. Unfortunately, right after I graduated from learning Korean at the Defense Language Institute, I had some injuries that made it necessary for me to leave the military service. That was one of the hardest days of my life because I really enjoyed my time in the service and the work that I did. But it was the right thing to do for my family and for myself to make sure that I was healthy enough to be a part of my life. So for the last 3 years, I have served as the Assistant Director of the Veterans Health Council. And the Veterans Health Council is a program of Vietnam Veterans of America. And their motto is, never again shall one generation of veterans abandon another. And in that light, one of the biggest undertakings that we've had is in the last year, my partner Rebecca Patterson and I have traveled around the nation educating medical students, nurses, nurse practitioners, doctors, even anesthesiologists, about the importance of asking the question, have you ever served in the military? With more and more veterans going into the community for their care, we want to make sure that that community is prepared for the unique healthcare needs that veterans have. Much like what Vietnam veterans went through in recognizing the toxic exposure that Agent Orange, what it was and what it did to their bodies, they want to make sure that veterans who served after 9/11 are aware of what their toxic exposures are and what it's doing to their bodies. So we're not only teaching our healthcare providers about veteran healthcare needs, but we're also teaching the veterans themselves, because sometimes, other than burn pits, they're not really sure what exposures they've had. So we've created things like brochures and programs to help educate them so that they can take charge of their own health care and go to that community health care provider and demand that they are seen and treated for the appropriate diseases.